Hello. It's Joe Farrer, Chief Executive, Kingston Hospital. I'm joined by Sally Britton, our Director of Nursing, and Tracy Moore, our Director of Operations. It's Tuesday, the 17th of March, and we're about to give you our latest COVID-19 briefing. Sally, would you like to give us some key messages?
Good afternoon. Currently in the hospital, we have 10 coronavirus positive patients. 4 of those are on our ITU and 6 of those are on our COVID ward. We've had 7 positive COVID since yesterday, and as you can work out from the numbers, some of those have gone home, so that's really good. New information for today is the current programme of self-isolation. So just to recap on that, if you are symptomatic and live alone, you should self-isolate for 7 days and then return to work. If you live in a family or a group house and one or yourself are symptomatic, then you should isolate at home for 14 days. Because of the way in which we work, people have been asking about testing staff in order to get them back to work earlier. And we're just waiting for national guidance on that because actually it's quite tricky. If you've got a household of people and we test you negative on a certain day, it doesn't mean that you won't then subsequently catch COVID. So it's really important that we use the national team. Some information about PPE, that is unchanged since yesterday, and you will find the table indicating what PPE you need on the intranet. But in essence, you only need full FFP3 if you are undertaking an aerosol generating procedure or if you are working in ITU. Similarly, we ask you to wear scrubs if you work in ITU or on the COVID ward, and we would ask that you change into those when you arrive at work and out of them before you leave. Other than that, precautions are unchanged, and we ask you to continue to wash your hands. Masks are getting, the supply of masks we've got is reducing as we expected, and we're expecting another supply, but please can I ask you to continue wearing your masks until they are wet or dirty or torn. It's difficult in that we know that we're waiting for long periods of time for people to be transported home. On the 20th, we're looking to start a new process whereby we'll have a specific provider who will take those patients home. And when that starts, we'll give you all the information you need to book them on. I'll hand you over to Tracy now.
Thank you. So we've had quite a lot of inquiries from staff on workforce issues, whether it's about guidance for pregnant staff or about childcare arrangements. At the moment, Kelvin Cheadle, our HR director, is working through a whole range of solutions in liaison with some of his South West London and General London colleagues. And we're going to have some question and answers tomorrow. And also Kelvin's going to do a YouTube video so that he can convey some of the solutions to those issues to as broad a group of people as possible. We talked about skills audit yesterday, and we really are imploring all of our staff to fill in the skills audit. It's important that you provide us with as much detail as possible, and also that you are aware that the form actually relates to all staff. It's not just nurses and doctors. So please fill that in and get that into us so we can assess your skills and where we could potentially deploy you to if we need to. Guidance for visitors has changed, and we've therefore changed our policy in accordance with that. And I'll read this out just to make sure that I am absolutely accurate. So visitors to the hospital must be family members or carers. And members of the public shouldn't be visiting the hospital for either inpatient, diagnostic or to outpatient areas if they're unwell, especially if they have a high temperature or a new continuous cough, or if they're vulnerable as a result of either their medication comorbidities, or if they're over 70 years of age. And we've also taken guidance that only 1 visitor per patient is allowable, and that's the case unless the patient is receiving end-of-life care or a visitor has to be accompanied. But even in that scenario, we would ask that the person who's accompanying the visitor actually doesn't go into our clinical areas, or if the visitor is a partner or birthing partner accompanying a woman in labour. And also no children under the age of 12 will be visiting without the express permission of the ward sister. We gave some contact information yesterday, and just to say, if you could check the global messages so that you can see the telephone number and the email address. This is for silver, so that if you've got any queries at all, any concerns, relating to the management of COVID-19, or if you've got any ideas about what we could be doing differently, then please convey those through to Silva so that we can gather those up and then give you a response as quickly as possible. As far as cancellations are concerned, as I said yesterday, we have cancelled some non-elective, some elective routine procedures. We've extended that slightly to include day surgery, and we've also extended it to include registrar clinics, outpatient clinics, and physio outpatient clinics. And the aim of this is to give us some additional workforce resource so that we can deploy that again to our ward areas, our ITU. As we extend that even further, we'll obviously keep you updated with those changes. Joe.
Okay, great. Can I also say that we've had some really good ideas of things we could do differently to help us manage through whilst this situation continues to evolve. And they have all been channeled through our Silva command. So if you're able to keep doing that, that would be absolutely fantastic. I'd also like to finally say that we had some really positive feedback around the use of this as a way of communicating. So we had over 841 hits, I think, yesterday, which is quite an achievement, and some really positive comments too, which is helpful. If you can keep those comments coming, we'll try and make these briefings as useful as we possibly can to everyone who sees them, and we'll keep amending our approach as we need to. But thank you very much for all your ongoing support.